Hello, everyone. Today, I will be talking about something that deeply affects our health, often in ways that we don't immediately recognize. We tend to think of health as hospitals in terms of doctors, medicine, but often, in reality, our health is shaped long before we ever step into a clinic. The social determinants of health are the conditions in which we live in, work, and grow. They influence everything from how long we live to our risk of disease, and even our overall well being. So today I will be reflecting on two key sources, Wilkinson and Marmot's 2003 and the Healthy People 2020 framework. They both emphasize that if we truly want to improve health outcomes, we must look beyond medical care and address the root causes of health disparities. There are five major determinants in which I'll focus on today: education, built environment, economic stability, healthcare access, and social context. Each of these plays a crucial role in shaping our health and the health of entire communities. If we start with education, we should know that it's no surprise that education is one of the strongest predictors of health. Wilkinson and Ormond explain that people with lower levels of education tend to have worse health outcomes. They live shorter lives and they experience higher levels of chronic disease. But why is that? Well, education often affects income, job opportunities, and even our ability to make informed health decisions. A person with higher education is more likely to secure a stable job with health benefits, understand medical information, and even practice preventive care. Healthy People 2020 stresses that early childhood education is seemingly and particularly important. If a child has access to quality schooling, they're more likely to graduate. They earn then a higher income and they have better health in adulthood. Think about it. If a child grows up in an underfunded school district with limited access to books, overcrowded classrooms, and outdated materials, they're already at a disadvantage. And that disadvantage follows them for life, affecting their employment opportunities, stress level, and ability to afford healthcare. Next, we can talk about the built environment, the physical surroundings we live in. Wilkinson and Marmot argue that where you live has a profound impact on your health. Imagine two completely different neighborhoods. One has clean parks and grocery stores with fresh produce, safe sidewalks, and good public transportation. The other one has poor housing conditions, no nearby grocery stores, high crime rates, and exposure to pollution. Which one do you think fosters better health? People in low-income areas often live in neighborhoods with environmental hazards, food deserts, and limited healthcare access. This leads to higher rates of respiratory diseases, obesity, because of the lack of healthy food, and even mental health issues. Healthy People in 2020 emphasizes that the need for urban planning that promotes health, things like green spaces and clear water and better public transportations, are essential, but achieving this requires policy changes and investment in unserved communities, which is hard to get. Next, we could discuss economic stability. This is a huge factor in health outcomes. Wilkinson and Marmot highlight that people with lower incomes have shorter life expectancies and higher rates for diseases. If you don't have a stable job or a reliable income, everything about staying healthy becomes harder. We can talk about it as if someone who is working multiple jobs just to afford rent. They might not have time to cook healthy meals, exercise, or even go to regular doctor visits. They may and will delay medical care because they can't afford the bill, leading to worse health in the long run, or overcomplication of a simple initial disease. And then there's the issue of stress. Living paycheck to paycheck, day to day, is emotionally exhausting. Chronic stress is linked to higher rates of heart disease, anxiety, and depression. Healthy People in 2020 suggest that financial literacy, job training programs, and policies that ensure a living wage could help address this issue. The challenge is that economic stability isn't just about individual choices, it's about systemic inequalities that limit opportunities for certain groups. With this point, we can move to healthcare access and quality. It's one thing to have hospitals and clinics nearby, but it's a completely different thing to be able to afford and use them effectively. Wilkinson and Marmot emphasize that wealthier individuals tend to have better access to healthcare, with low-income individuals often experience barriers like lack of insurance, long wait times, and transportation issues. Even when healthcare is available, not everyone receives the same quality of care. Racial and even economic disparities play a big role. A person from a wealthy neighborhood may receive more thorough medical attention than someone from a low income area, simply because or due to systemic biases in healthcare. Healthy People in 2020 emphasize and they stress the importance of expanding healthcare access and making sure that care is both affordable, equitable, and the same for everybody. Lastly, we could talk about social community and context. This especially is about relationships, social support, and community engagement. Wilkinson and Marmot point out that strong social networks improve both mental and physical health. Loneliness and social isolation, on the other hand, they increase stress and the risk of conditions like heart disease and depression. Think about the difference between someone who has a strong support system, family, friends, co-workers they can rely on, versus someone who is isolated and lacks connections. The first person is most likely to seek help when it's needed, feel emotionally supported, and even engage in healthier behaviors. The second person, however, they may struggle with chronic stress, have limited motivation for self care, and experience worse health outcomes. Healthy People 2020 highlights factors like discrimination, violence, and incarcerations also play a role in health. If someone faces a racial or social discrimination, they are more likely to experience chronic stress, which can lead to conditions like high blood pressure. Similarly, communities with high crime rates often have lower levels of physical activity and higher level of mental health disorders. So, what does this all mean? Well, it means that health is not just about genetics or personal choices. It's about policies, environments, and social structures that shape our daily lives. The conditions in which we are born, we grow, we live, and we work, and age determine our well-being just as much, if not more, than just our individual behaviors and genetics. If we truly want to create a healthier and more just society, we need to shift our focus from treating diseases to addressing the root causes of health disparities. This means advocating for better education systems and ensuring that every child, regardless of background, has access to quality schooling, proper nutrition, and the knowledge they need to make informed health decisions in the future. It means investing in safe and healthy neighborhoods with clean air, green spaces, and where access to nutritious food are available to all, not just a privileged few. It means ensuring fair wages so that people don't have to choose between paying rent and buying medication. Expanding healthcare access is another crucial step. It's not enough for healthcare services to exist. They need to be affordable, culturally component, and free from discrimination. Many people, particularly migrants, low-income workers, and marginalized communities, face barriers that prevent them from receiving the care they need. Breaking down these barriers requires not just policy change, but a shift in how we view healthcare. It's a basic human right, not a privilege. Beyond policy, we need to strengthen social support systems. A strong community, a reliable support network, and access to mental health resources can significantly improve well-being. Loneliness and isolation are real public health concerns just as much as physical diseases. Investing in community programs, mentorship initiatives, and support groups can reduce stress, improve mental health, and create resilience. Now, we can be honest. This is a huge challenge. But history has shown that real change is possible when communities, policymakers, and individuals come together with a shared goal. We have seen policies improve public health before, from sanitation reforms that eradicated cholera to labor laws that reduced workplace injuries. The same could be possible today, but it does require intentional action and incentivism. So, I would like to leave you with this thought. Next time you think about health, think beyond medicine. Health is much more than just doctors and hospitals. It is about the opportunities that we have, the environments that we live in, and the policies that shape our daily lives. Every time we advocate for better school, fair wages, safer housing, or improved healthcare access, we are advocating for better health. And I also challenge you to ask yourself, what could we do both as individuals and as a society to make health more equitable for anyone? How can we all use our voices, for those that we have one, our votes and our actions to create real, lasting change? At the end of the day, a healthier world is not just an idea, it is something that we all deserve. Thank you for listening.